Welcome to another episode of Coffee with Carriers. I'm Tim Falanga, Senior Vice President with Amwins Connect. Today I have a special guest, Mr. Mark Quinn from Anthem Blue Cross and Blue Shield of Connecticut. Mark is the brand new Regional Vice President of Sales and Account Management for Anthem Blue Cross and Blue Shield. So Mark, thank you for joining us.
Absolutely. Nice to be here.
Great for you to come out and meet with us today and chat about, your new role and,
Sure.
and everything that's happening at, in the business, in the economic landscape that we're in. One of the things we like to do, though, is to, first of all, ask a little personal things.
Sure thing.
What about Mark Quinn? What's your background, both personally and business-wise?
You got it. Thank you. So I've been in the health insurance industry since the mid-'80s and spent the first 20 years or so really in an operational-based leadership position, managed a lot of different leadership and operational teams, which when I transferred to sales was a new mindset for many salespeople. I came from the world where once it's sold, we have to service. So my culture and my drive within the teams that I build has to be, in order for us to win, we have to retain. In order for us to retain, we have to deliver on the commitments we've made. So to me, servicing and honoring the commitments that we make during the sales process and delivering on operational excellence are critical to our short-term and really our long-term sustainability.
It's kind of neat, being in the sales role in the insurance industry for me for the last 34 years. I tell people, my kids, Dad, what do you do? I work in gray areas, right?
Yes.
In sales, you're always kind of meandering around.
Right.
I think operational, I think black and white. It works this way or it works that way. How will you adjust that?
Very good question. To me, the opportunity is to partner and bring our operational people into the fold. To me, they are salespeople too, because our ability to meet our customer and member needs is directly aligned to internally our ability to deliver operational excellence. So I need them to understand how the work they do aligns upstream to my ability to retain and to sell new business. So to me, it's a partnership and it's fluid.
Yeah.
And there might be operational areas that are needing attention today that we need to focus on, but we need to make sure that we're always aligning across the enterprise to ensure that we are delivering that operational excellence.
Yeah. So when you talk about operations and kind of, your background, how do you think that will translate in market here in Connecticut? What will clients see something different? Will brokers see something different?
Sure. So on day one, meeting with my team, and I'm fortunate, I have a very tenured team, a very experienced team, and a very motivated team to really deliver high quality of service to the clients and the members for which we serve. On day one, we had discussions about it's my responsibility to create a strategy for us to win in the market. It's my responsibility to make sure that people have access to the tools and solutions we need to deliver to the market. But most importantly, it's developing a culture over time that puts operational excellence first and foremost. And where we see a bump in the road, we address it quickly.
Yeah.
And I often tell the teams, treat every day like a renewal. So if this case was going out to bid, this is the most important issue we have to solve for today, and translate that into demonstrating to the producers that are an important distribution partner of ours, to the members and the clients for which we serve, that we are here to help. And my goal is, over time, the market reaction will be a level of service excellence that is building upon an already strong brand in the marketplace.
Yeah. Very, very strong brand in the marketplace.
Yes.
No doubt about it. No doubt about it. Something I forgot to mention when we started, our organization, Amwins Connect, began our adventure and journey with Anthem Blue Cross and Blue Shield in 1997. So congratulations on your 25th anniversary of being a general agent with us.
Great to be a
together.
partner with you. Absolutely.
One of the things that you and I had talked about is the sales organization and clearly the operational aspect of delivering on what that sales promise is. But what does the sales organization, what's your vision of that sales organization? Will it change in the marketplace, the approach?
I expect it will. And by that I mean, my strategy is always, we need to listen to our clients. We need to listen to our prospects. When you get an RFP or you're working with a producer, it's really understanding, why is that client out to bid, or why is that prospect available? What do they need to solve for? And then I will work with my teams to ensure we bring in the solutions that directly align with the needs as defined by the client, the producer. At the end of the day, we need to ensure that we deliver on the financial commitments that we make, that we deliver on the member journey, and that's a critical piece to me, is ensuring that that member journey is as streamlined, and we take what can be a complicated navigation for a member and make it as easy as it can to direct them to high quality, low cost, and affordable health care. So you had posed a good question, which is, what else in the sales organization might we see as change? I'm challenging the team now to demonstrate to me, what is the value of Anthem? The brand is the brand, but what do we do to earn and support that brand? Mm-hmm. And from a network perspective, a broad network, a very strong relationship with healthcare partners across. From a clinical management and medical management, what are we doing on those fronts? Mm-hmm. And really being able to tell a total cost of care story. And I always want it to look at the constituents for which we impact. So how are we helping the client solve for their needs? How are we helping the member through their journey access care as they need to be and should be? Mm-hmm. How do we impact and work with and partner with our producer partners to ensure that we are delivering and helping them meet the needs of the same client that we both have the fortunate ability to serve? And then our provider community is a key part of the entire process. So what are we doing across those four spectrums mm-hmm. to deliver value and service that is different in the marketplace than an experience they may get somewhere else?
Yeah. You know, the whole pandemic thing, right? The last couple of years
Yes.
has vast amounts of change all over the place.
Sure.
Has that had anything to do with the things that are changing for you folks as you go forward?
So the COVID question is a great question that everybody's been working through. It's fluid. Every business has been impacted by it in a different way, mm-hmm. and we need to meet those clients where they are and help them still engage their members, re-engage with their providers, and provide solutions to help them do that. One of the things I think we all found was the telehealth and virtual medicine. It's been in the market for years, but the engagement rates have typically been low. And I think we all realized during the pandemic that this was a new opportunity to introduce and or reintroduce a solution that's been in the marketplace. And I think as we move forward, we have to leverage what we've learned in that space. And at Anthem, we are continuing to build out virtual primary care, virtual visits, getting people out of maybe emergency rooms or getting them out of urgent care, allowing people that might be at home with kids the ability to have that same experience, get diagnosed, and get maybe the pharmaceutical needs that they need without having to go to the doctor. And that's a real transformation that the industry and we've all realized is really a new opportunity for us going forward as we look to transform the way we engage our members and provide them access to quality care.
Yeah. I'll tell you, I was never a big fan of the video doctor exam, and I ended up doing one myself, during COVID, and it's a heck of a lot easier. I don't have to go in the car. I don't have to go wait in some waiting room for 25 minutes. And at that point, I'm putting on my member hat as well as being a broker, and it gives me the ability to talk about that value with brokers, right? Hey,
sure.
You should be telling your clients to do these things.
Absolutely. And there are certain industries that really may lend itself to it well. I mean, if you have an industry or a business that's truck drivers who are oftentimes on the road and don't have the same access to or the ability to access a local doc, the ability to have this alternative solution and really make sure that they're getting the care that they need at the point in time where they need it is really transformative in terms of we're in the early stages, but I could see moving forward, this market will continue to evolve.
Yeah. So Mark, having been a general agent for Anthem for 25 years,
Yes.
We've seen and been a part of that journey.
Sure.
I don't know, I think it would be worthwhile just to kind of ask your perspective as where has Anthem been?
Right.
And then we can pivot to where are we today? And maybe what do you see down the road?
The Anthem of the past, if you will, if we look where we've been, we've always had a very strong brand. We are strong in 14 states, but we do business locally. And, what we do in Connecticut is specific to understanding the needs of our Connecticut communities for which we serve. Where we are now is really starting to transform and move forward. And the opportunity to me is real. For example, our partnership with Hartford Healthcare. You have one of the largest provider systems in the state with breadth and depth like we do, coming together to look at opportunities to change the relationship between a historic carrier and provider relationship, and really partnering with each other to say, how do we improve cost, but also how do we look at cost and quality, and introducing high-performing networks, introducing technology to help increase engagement, and really looking at member health outcomes and measuring. For a diabetic, for example, what percentage of that diabetic for that population is getting their A1Cs, is compliant with their pharmacy? To me, the more we move the discussion from the quarterly high-cost claimant review and we move upstream to preventive care, primary care, early detection, and do that through technology tools and partnership with our provider friends, I really think we have the opportunity to transform the financial system, and more importantly, provide members now the ability through our Sydney tool, for example, to look at which provider might provide the most effective cost of care and high quality care. So we're transforming the discussion about pure cost to cost and quality.
Right.
And lowest cost doesn't mean the best outcome, nor does highest cost translate to the best outcome. And I think that is a new, innovative way to look at that journey and engage members in a way that maybe we haven't in the past, or not to the same degree that we can in the future.
Yeah, as a patient, having the ability to see some reviews of a provider where our parents used to just go to the doctor.
Or a friend.
They were all the same, right?
Or a friend told you this doctor is good.
What is the provider's feedback on that type of an application in Sydney where they can see outcomes and grades, if you will?
So I think the partnership is strong, and I think the providers that are those high-performing providers really look favorably upon it. And it's an ability for the provider to demonstrate in key criteria and metrics that we can measure that their results truly are a better outcome and a better experience for the member. And then the member has access to that same information. So the digital tool in Sydney really start to introduce a new manner of engaging and bringing the member into that decision-making process, where they're no longer just necessarily going to a provider because a friend said, that's where I went. Now they have data points and analytics to demonstrate this is the provider I want to go to and why. And I think that's an exciting transformation.
So selling those a medical case and the ancillary case provides a lot of data and a lot of good information for both Anthem and the patient. Could you speak to that a little bit?
When we have all of the data and we bring that in-house collectively and together, we do see better health outcomes. We do see an improved level of engagement when you have the medical and the pharmacy, and you can look at what's happening on the medical side and what's happening on the pharmacy side, because they are always related.
Right. having the coordination,
Correct.
the vision into those other benefit lines.
And ultimately, we're trying to provide a simplified member journey, a simplified client journey that ultimately saves the client money and is improving the wellness of the members for which we serve.
Helps reduce costs as well. From a product standpoint, one of the things that we have really taken to here in Connecticut is level funded business.
Yes.
I don't know if you have a viewpoint of level funding and maybe how that counterbalances or is juxtaposed against your fully insured business in that space.
I think level funded is an exciting new opportunity in the marketplace. I think the key to the success is really identifying the right clients for level funding.
Right.
Those self-insured clients that don't necessarily feel they need to be fully insured, but are looking for some sort of fixed monthly cost. Mm-hmm. And on the fully insured side, it could be a stepping stone or a permanent home as they think about moving away from fully insured business. So yeah, the key is from a medical underwriting perspective to really understand the risk profile, mm-hmm. so that the group who makes the decision to move to balance funded really has not only the benefit of a fixed monthly cost, but based on actual risk scores, has the opportunity to share in that surplus.
That's right.
The following year. If you are writing bad risk into those balance funded plans, unfortunately, they typically don't realize the financial savings piece or offset, and sometimes the increases might cause them to go back to fully insured. So for me, it's being consultative and talking to the producer about why this is a good client for balance funded, right. And or they may want to. We personally view that risk as one that may not be the right client at this point in time. Mm-hmm. And through consultative discussions with you and the client, determining what is the right solution for them at this point in time.
Yeah. One of the things that we've seen in market, and we talk to our brokers about this a lot, is when we, a couple of years back, rewind, we were only in the fully insured space and we right. weren't doing the balanced funding business.
Right.
Now that we're talking balanced funding, there was a lot of non-engagement in wellness provisions.
Sure.
Because an employer didn't have or see the direct result on the premium side, right. if they engaged in wellness.
Right.
Well, if you're in a level funded or a self-funded program, you have every reason in the world to put that walking program in place, or that smoking cessation program in place. Right. Those things create alignment with you as the carrier, with the clients, and and the brokers. And I think that's
absolutely
yes. That story in the marketplace is one that that we talk about a lot when we're out there.
Yeah, and we really do view it as an exciting new opportunity for us in the marketplace.
Terrific. When I'm thinking about the marketplace and all of the brokers that we all touch, your team, our team, we're in alignment on wanting to get out in the market and
right.
kind of get back to it. And you're newer, right? You're new.
Sure.
You're new to your role.
Sure.
What do you see your sales teams looking like in the field when they're talking to brokers?
Sure. So I have had initial discussions with both my sales and account management teams. The message is COVID is not gone, but we need to work within this new environment in a way that we need to be back out in the market.
Yeah.
And I've been here for 7 weeks now, and I've already met with 7 of our producer partners. We need to be out understanding how has the COVID pandemic impacted our producers. Like, what are their needs, and then how can we help serve and support them in the marketplace, and maybe provide them some insight as to how it's impacted us. But this is a person-to-person business. This is not a Zoom business, and I know we had to for 2 years.
Right.
So I want to see heavy engagement. I want us to go out and educate them on new solutions. As a general agent, would love to partner with you, and to the degree that we can, the sub-producers that are direct line working with the customers, making sure they understand what Anthem is doing and how we're different in the marketplace.
Yeah.
What are those solutions? And that doesn't happen through a Zoom call, but it does happen and really makes a difference if we spend the time to get out in the marketplace.
Yeah.
So it'll be a slower transition, but as we head into the summer months, I expect us to be fully engaged with our clients, listening to their needs, bringing back those needs and identifying solutions. partnering with our producer friends and understanding how we can work together. You have needs and objectives and goals just like I do. And I typically like to share what mine are and understand what yours are, so that through the year we understand how we can help support each other.
One of the things that I know that we encourage our sales teams to do is to go out in the field with their carrier rep partner. Go out with the folks from your team and talk to the brokers together. We're not an extra layer, we're an added resource. And together, we come with a heck of a lot more power and market clout than we do individually. So
right, and I think we can help you, and I think you can help us. And I think from a client perspective, seeing the producer and the Anthem in this case working together and collaborating on solutions and listening to their needs, I think just further strengthens our ability and your ability to demonstrate to that client that we are truly delivering solutions that they need and they've asked for.
Agreed.
Yeah.
Need-based selling.
Yes, absolutely.
The old classic.
Yes.
One of the things that I feel, Mark, has really made a difference in the 25 years that we've been at GA with you is the relationship.
Sure.
The people, right?
Sure.
And I think that over time you will begin to see that we've become really good relationship managers with your team already. And I just wonder if you could comment on relationship and
absolutely. I think it's critical. It's fundamental to what we do. It's a foundational building block. We need to be out in person, meeting with our producers. It is a person-to-person business, as you described. And it's all about building relationships and understanding each other's needs. When you need something, or if I need support, I need to know that you're going to support me, and you need to know I'm going to support you. And that happens through spending time together, getting to know each other's business orgs, challenges, and opportunities, and building those very strong, long-lasting personal relationships.
Yeah, makes the world go round.
Yes, it does.
So, Mark, super to have you here, and to know that you're a Connecticut guy, working here in Connecticut with one of the most prestigious carriers in the country. It's awesome to have you. As you kind of gotten into your role, is there anything new that you kind of see on the horizon here in the state that our mutual brokers would want to hear about?
Great question, and thank you for asking it. There is a new opportunity. It's called Covered Connecticut. And what it does is it provides an opportunity for zero premium, zero healthcare costs for those members in communities that qualify based on financial income. Okay. The program is going to really help the underserved, the underinsured, or potentially even the non-insured get into a network-based plan, a healthcare plan with an Anthem, and really provide them access to the care that they need. So these are typically the underprivileged communities, and we are excited to get out in those communities to educate them as to what might be available to them and provide them the information they need to determine if they qualify, and then if they do, to help support them to get enrolled. And this is an exciting new opportunity for us, and I think it's really exciting to help those communities of need.
Yeah. Is that something that is part of the exchange here in Connecticut? Would it be different or in addition to the subsidies that are available to the?
It would be separate from the exchange type products that are available in the market today.
So with Access Health CT, this is going to be a program that's going to complement that or be a part of that program.
That's correct.
With new brokers in going out to help enroll these folks who may not have even known that they've had the ability to get this coverage before.
Correct, and it really starts with Connecticut recognizing this need to determine if you're eligible, because there might be individuals who previously didn't qualify for certain subsidies that might qualify today. Mm-hmm. They can go to Access Health CT and determine if they're eligible for this program, and the enrollment period starts 7/1, and really is a great opportunity for a member to really gain access to an Anthem plan that otherwise they would not have that access to.
Right. That's amazing.
Yeah, very exciting.
Good deeds in the community.
Yes, absolutely.
Mark, I can't thank you enough for joining us today.
Thank you for the opportunity.
Really great to meet you. Wish you a lot of luck in your
Thank
new
you.
role. We're happy to have you and really looking forward to it.
Great to be here.
Any parting words that you'd like to have for our broker community out there?
Hello, I'm Mark Quinn. I'm the new Regional Vice President for Anthem, Connecticut. I'm excited about the opportunity to join the Anthem organization and really excited to have the opportunity to work with all of you in the future and look forward to developing a strong partnership as we work together in the Connecticut marketplace. So thank you.